Alright, good morning. Welcome back to the channel. Thanks for tuning in today. So on this episode, we're going to talk about the difference between postpartum blues and postpartum depression, because I think it's really important for mothers who are in that postpartum period to get some answers or clarity on what it is that they are experiencing, to know that it is really common to struggle with this transition and to ask themselves some questions in terms of how they can be relieved and how they can begin to get on the other side of this hurdle that is the postpartum experience and receive the support that they need. So my goal is to really just connect you with the support that is most suitable for your condition. And I want you to be able to tell the difference between these two very prominent conditions during your postpartum period. Now, postpartum blues describes a state of disconnection or discomfort, withdrawal from your family, from your friends, excessive crying, panic attacks, and just generally feeling like an inability to bond with your baby. So this is usually it occurs usually within the first 2 weeks during postpartum and can subside within the third or fourth week as you begin to adjust and accept your physical, emotional, and hormonal changes. I think as you begin to realize how the baby is constantly changing and how you are constantly changing and growing, and you begin to see some of the rewards to it, like the baby will start to smile and you'll start to just feel a better handle on your schedule, or if nothing else, like if your schedule isn't improving, you will at least have more compassion for yourself. You will start to see well, I did this today and I did that today, and I understand that the baby's always changing, and I've been patient with myself, and I'm only 3 months postpartum and I don't have to look like that. I think it's more an acceptance of where you are right now and being patient with yourself and your child. I think as you start to perceive yourself differently and perceive the situations differently, but also just accept how different the situation is, you'll start to become better acquainted with all the changes and how that differs from postpartum depression. Is that postpartum depression describes instead intense feelings of hopelessness, worthlessness, and shame, maybe guilt, like loss of appetite or overeating. You reduce interest in what you thought you would be able to do during this time period, reduce interest in your goals, and it can also be characterized as feelings of wanting to cause harm to yourself or others. And it's very challenging to experience, especially during a time period that you perhaps expected to be more, have feelings that were more positive, to be more connected, to feel this bond. And perhaps you're not meeting your expectations emotionally, and your surroundings aren't meeting your expectations. Everything's just unexpected and not how you planned, and it can be really challenging to accept and understand the symptoms that you are experiencing on a daily basis during this time period. And what I do appreciate in terms of just making the distinction between general depression and postpartum depression is that it is specifically related to this time period. Perhaps the feelings of shame and worthlessness are related to postpartum, are related to birth or pregnancy or parenthood, and that's just such a unique experience, and it being at a time that you perhaps thought would be more happy, it can really be debilitating in one's effort to seek help. So on the other hand, though, there are so many people who are willing to provide these resources to help you with your mental condition. And these symptoms usually arise around 4 to 6 weeks, and that's when they can be observed. And that's also when they start to become a challenge to the mom's ability to function, and perhaps also the family and the household. So 3 questions to ask after you receive this information. This is just like some suggestions as a doula in terms of journaling and how you can make sense of what you've learned. So the first question, I would say, what is the story I'm telling myself? And the reason that would be the first question is because the follow-up I would want to be, does this story begin with pregnancy, conception, or birth? Or is it related to your life and experiences before then? That's question number 2. And question number 3 is, do you think that how you feel and the current situation and any current challenge that you're experiencing with parenting or with postpartum healing, do you feel that this situation can or will improve with practice, with patience, and with time? Like, do you think that this can be different? It can be better? You can learn? Do you think that? That's the third question. And then, so the fourth one and the final question. As you journal, I would really reflect, and you can also really do this during meditation as well. But have you been gentle with yourself about the physical, emotional, and hormonal, don't forget the hormonal, challenges that you're experiencing? And in addition to that, spiritual as well. Just everything from going from being a single person or an individual to then growing another person inside of you, and then being responsible for their growth outside of you. Have you been gentle with yourself? Have you been compassionate with yourself with this large commitment and large responsibility? You know, are you giving yourself time to learn? Are you giving yourself time to grow? And lastly, I want to share some of the resources that I can think of to help. And there are so many more. So I would urge you to consider more options beyond this video. So I'm just going to give an introduction. One of them is therapy via your health insurance. Another would be therapy via a YouTube therapist. And by this, I mean there are so many therapists and counselors on YouTube that are licensed and qualified. And while they will not speak to you, speak to the camera as though you are a patient, and they will not be able to diagnose or treat you, they can provide a lot of the advice that they have learned related to your specific condition. They can give you tips and pointers in terms of how to keep going. They can give you ideas about medications or herbal supplements that you can bring up to your healthcare provider. They can provide you with healthy coping mechanisms, with practices to employ in those moments of crisis. They can just give you maybe a soothing voice to listen to that is gentle, that is compassionate to your experience. They can also give you some quotes and phrases and books that can help you explore this more on your own. You can receive journal prompts. And that said, there are also so many doulas and moms who can provide journal prompts, who can provide opportunities to meditate, opportunities to get moving in your body, opportunities to reflect on your experience and to see what it is that you really want to get out of this journey of postpartum. So I would say that YouTube is a great resource. There are so many qualified professionals who just want to share their nuggets, like small nuggets of wisdom, small nuggets of encouragement that have helped their clients. Because you may have a story that is like identical to a client that they've gone through. And again, they won't be able to diagnose or treat you, but they may be able to give you pointers on how that person made it through. That said, there are also a lot of coaches, mindset coaches, or coaches when it comes to homemaking or motherhood that can help you improve on your skills. And so you will not feel as though you're continuing to and create some of the same patterns that you've noticed are not serving you or helping you achieve your goals. So it's really important to know that during your postpartum period, you're not alone. A lot of times there are loved ones who are there that may feel that they don't have the tools to support you. They don't have the tools to give you the relief that you need, but they do want you to receive that, and they will be here with you on your journey. So I hope that this video was helpful to you. I hope that you are able to connect with a resource that can support whatever mental state or mind state you're in right now, and that you are able to gain some information to determine whether what you are feeling and experiencing, sounds like something that you can manage with someone you trust, manage with a trusted professional, and just gain some more clarity there. So thank you for watching once again, and I hope you have a lovely day. Take care.